Well-Being, an outlook on eating disorders using social and developmental psychology. My name is Ashley Campbell, and this is my final presentation for Psychology 400. Eating disorders and well-being. Eating disorders are continuous disturbances regarding eating habits and behaviors which impair physical and mental well-being. There are three types of eating disorders. There's anorexia nervosa, bulimia nervosa, and binge eating disorder, all three of which impair our well-being. Eating disorder effects on well-being. There are many different factors which will negatively impact our well-being regarding the different types of eating disorders. So for anorexia nervosa, there's around a 50% chance the individual could potentially die. This would clearly be the worst possible effect on our well-being. The individual will usually show an increase in depression. There will be an increase in obsessive behaviors. This could include monitoring calorie intakes, consistently monitoring their food intake, and working out in excess. There's an increase for health problems. For example, they could have an increase in high blood pressure. There's a decrease of estrogen if the person affected is a female, or testosterone if the individual is a male. Anorexia often weakens the bones, usually because of the calcium deficiency, and it will increase the individual's fear for weight gain. For bulimia and binge eating disorder, many of the negative impacts on well-being are similar. The individual will often overeat and later result in purging if they're bulimic. They will usually have low self-esteem, and it will contribute to the onset or the maintenance of obesity. The individual will often be depressed. If the person is bulimic, they will often experience slowed gastric emptying and the enlargement of gastric capacity, which will negatively impact the individual's health. How self-esteem, age, and gender play a role. Eating disorders are most common in females. They usually peak between the age of 13 and 18. Women have lower self-esteem from body image, depression, and anxiety. Gender differences exist for low levels of self-esteem in adolescence to young adulthood. Psychological distress increases in girls during the age of adolescence. So this research by Just Daughter examined the gender differences between self-esteem and age. So when the individuals were around the age of 23, there was no gender difference between self-esteem, or there was no age difference between self-esteem and their gender. But when women hit the age of 23, they resulted with more of a dissatisfied outlook on their body image overall. This is relevant to well-being because it shows that girls in the age of adolescence are more likely to have lower self-esteem, and it can relate to their dissatisfaction and stress on their body image. What might influence eating disorders? Some factors that could be included are media pressure, family, peer pressure, low self-esteem, and body dissatisfaction. Looking at the media may negatively impact someone's well-being because the media often portrays images that are photoshopped. An individual may want to look like the person they're viewing in the media. Family may negatively affect the individual's well-being because they could make comments about the person's weight, making them want to change their appearance. Peer pressure is another factor that could influence the individual to have an eating disorder. I personally believe this is a major contribution to eating disorders because when I was in high school, I had anorexia, and one reason that strongly impacted me was what others would say about my appearance. I used to be a little overweight, so eventually I became embarrassed. People would say things, and I lost weight, but then I became obsessive about it and continued to want to be as thin as possible. So no one would say anything bad again. Having low self-esteem could also contribute to an eating disorder. They may want to change their appearance to boost their self-esteem about their image. And then finally, looking at body dissatisfaction. When someone is dissatisfied with their body, they may be willing to do anything to lose the weight as quickly as possible, and it's extremely unhealthy, and physically and mentally will impact their well-being. This slide looks at the socio-cultural influences in our society. So an individual may struggle to develop their ideal image. I think this is important because society implants in our minds through images, advertisements, media that we should be thin. I found the pictures on this slide to represent that statement. So on the right, you see a model. It's clear she has almost no body fat and she's slim and flawless. The top right image shows two girls who are wearing shirts that say, "Nothing tastes good as skinny fills." This image honestly disturbed me because the message we're sending out is portraying flawless, thin individuals into the media. Many people want to look at the individuals look up to the individuals they see in the media, which is why there's an image of Demi Lovato. This is somebody that I felt openly talks about their body image in society, and she's talked about how Hollywood put pressure on her to lose weight. It's a little cut off, but her hand says the pressure to be perfect. Now, the next bullet point looks at the societal differences between the peers. And in the research, it discussed that interpersonal difficulties between peers may influence severity in eating disorders. The research also discussed how women have to have pressure to be thin and how women are more attentive to their body image than men are. I think this influences why women are more at risk for eating disorders. And finally, the exposure of particular media leads to body dissatisfaction. I found this research kind of interesting because it mentioned that individuals who watch soap operas were more likely to experience body dissatisfaction. And the majority of individuals that watch soap operas are probably women. Eating disorders and attachment. Bowlby's attachment theory determines the type of attachment style the infant developed with their parents, and how the attachment style can influence the well-being of the infant. Eating disorders are more prevalent in women who perceive to have low communication, warmth, and trust with their parents. This idea can relate to Bowlby's attachment style of the avoidant infant, which was examined in the research of Hazen and Schaefer. The research regarding attachment style in relationships was prevalent to the person in the relationship's attachment to their mother as an infant. When individuals experience alienation between their relationship with their parents, it's associated with higher eating disorder symptoms, which results from the impairment of self-esteem and negative mood. This is clearly a negative impact to individuals' well-being regarding self-esteem. Child maltreatment could potentially be nonspecific risk factors for eating disorders. So these include the physical and emotional neglect, exposure to intimate partner violence, physical, sexual, and emotional abuse. Individuals that experience these are often experience eating disorder behaviors. The research didn't conclude to a firm conclusion on how the factors strengthen the relationship to eating disorders, but the research it could relate to attachment later on and how it affects the well-being of an individual. Oh, sorry. Okay, how they relate to attachment. Bowlby's attachment theory determines when an infant is left alone by their experience, their emotional distress, and reactions. This can relate to risk factors for eating disorders because it regards the emotional and physical neglect of child maltreatment. According to Kimber et al., child maltreatment experiences are also associated with significant increases in one's risk for mood and anxiety disorders, substance use disorders, and alcohol use disorders. All of the factors are prevalent to eating disorders because they're usually occurring in individuals with eating disorders. It's prevalent to well-being because child maltreatment regarding attachment and risk factors such as interpersonal violence and abuse could potentially lead to eating disorder behaviors in the future. So this was just some things I figured could help prevent eating disorders and improve the well-being of those who have an eating disorder. I think one thing we could do would be to influence body positivity in our society. I think if we showed more of a diverse body image amongst the media, this could help individuals increase their well-being by not trying to achieve a different body image other than their own. or seeing someone with a similar body image could make them feel more positive about how they view themselves. I believe we could help the person regain positive effect towards social interactions to help improve the interpersonal problems that the individual faces. And we could increase the amount of social support, and increased amounts of social support can influence higher self-esteem. And this is important because, according to DeLongis, Lazarus, and Folkman, unsupportive social relationships and low self-esteem were more likely to experience an increase in psychological and somatic problems. And that is the end to my presentation. Here are all of my references. They are a little small, but there's quite a few of them. Thank you guys very much.